Thank you for watching this short presentation that talks about how we have embedded active learning to reduce medication errors. The course where we have done this is a first-year Bachelor of Nursing course that has a focus on medication safety. The course is taught across 3 campuses to a cohort of around 700 students, and it introduces these students to the complex nature of medication administration, patient safety, and importantly, error prevention.
One of the significant challenges that we faced in this particular course in the first iteration was the fact that students don't have any prior healthcare knowledge or experience within which to situate the complex medication safety concepts that we were delivering in the classroom. And so to address this, we developed a series of targeted teaching strategies which would help students to understand the concepts that we were delivering in the classroom and also raise their awareness so that when they did go out on placement, they were able to highlight error-producing situations. So the teaching strategies that we developed were scaffolded medication calculation competencies that were directly related to clinical practice, having a very clear understanding of the roles and responsibilities of the healthcare team members that were involved in medication administration. And we also recorded a series of short digital recordings that demonstrated the system factors associated with medication errors. So the very first strategy that we implement in the course are medication calculation activities that help to increase the students' confidence, not only in terms of the arithmetic, but also how medication calculations occur in the clinical environment. So the very first step is that the students are taught how to review a medication order to ensure that the order is valid. The next step is to, we teach them to undertake the complex nature of medication calculation, which can involve up to 8 different steps. And then the third thing that we do in the classroom is that we actually simulate medication administration. The second strategy that we've implemented was that students need to understand very clearly what their role and responsibility is in terms of medication administration, as well as the role of the prescriber and the pharmacist. By having a clear understanding of these unique and sometimes similar roles, we are able to demonstrate to students how errors can occur and how that they can actually prevent them. One of the key things that we do focus on is how they communicate effectively between the team members.
Finally, we developed a series of short digital recordings that demonstrated that medication errors can be promoted with a series of systems factors. So these included things such as poor interprofessional communication, distractions included in other environmental factors, and errors associated with dispensing. And we also highlighted the continued use of the rights of medication administration and how important these were for ensuring that the right patient got the right dose of the right drug through the right route at the right time. By highlighting the systems factors that were associated with error, we were able to demonstrate for students that when errors occur, they're often the end result of a series of culminating factors rather than the carelessness of a particular individual. Highlighting these factors supported student learning with inquiry-based learning. So in summary, by the end of the course, we hope that students are able to be highly aware of the fact that nurses play a key role in the safe use of medications, and by embedding a suite of active learning strategies in our Bachelor of Nursing Medication Safety course, we were able to increase students' confidence and competence with medication calculation, enhance their understanding of the interdisciplinary roles of all healthcare team members, and demonstrate the influence of systems factors in error production and, importantly, their prevention. Thank you.